Hello, everyone. This is Bella Mehta reporting for Room Now at the EULAR conference in Barcelona. This is a very interesting study that I came across, which is an innovative study from the Samsung Medical Center, which rethinks how to use MRI and artificial intelligence together to diagnose axial spondyloarthritis or axSpA. We all know that SI joint MRIs play a central role in diagnosis of axSpA, and the current criteria also focused heavily on looking at bone marrow edema or BME. But BME can also be seen in healthy individuals, postpartum women, as well as after exercise, or and sometimes it can be not present in long-standing disease where bone marrow edema is gone and now there's just structural changes. So this study tried to find a niche where an AI model integrates both inflammatory features, which is bone marrow edema and things like that, as well as structural changes. Sort of trying to mimic the real world clinical decision making. And this was a tedious study because the researchers analyzed scans from around 300 patients with chronic back pain, and around 50% of those were clinically diagnosed with axSpA. And again, they created this AI framework, or the deep learning network, where they combined two kinds of MRI sequencing, the STIR and the T1 weighted imaging. The STIR captures inflammation, whereas the T1 weighted images captures more like erosions, fat metaplasia, ankylosis, which is something which was much more chronic. So how did this perform? Just for bone marrow edema detection alone, it achieved 82% accuracy, which is on par with other conventional standards. Like what? A lot of training is required for clinicians to start detecting these. But for just predicting a diagnosis of axial SPA, the model achieved an AUROC of 0.94, which is nearly 86% overall accuracy. So pretty impressive given that it's a bot doing this. And it identified 6 out of 9 patients who would have been missed by current ASAS MRI criteria. So in fact, it not only helped diagnosis, but also improved the real world diagnostic sensitivity. So I think this work is very exciting. First, it can show that AI can detect imaging features and can begin to approximate clinical judgment. Second, it validates multimodal approach that reflects two kind of parameters, or two kind of images that go in, and they, with both kind of images that go in, you detect active inflammation and chronic changes or chronic damage, echoing what we have been taught in clinical practice and by our radiology colleagues, that you need to look at both when you're trying to diagnose or make changes in the treatment plan for these patients. So again, this is an interesting study. It's smarter, more comprehensive AI tools are going to come in to help with these tasks. And again, as we know, AI tools, at least at this stage, perform best on imaging. And this is a real world example that we saw at EULAR. Over the next few years, we'll see more of these. But this is definitely an interesting way to start diagnosing our patients. With that, follow me more for updates on Twitter at Bella_Mehta, or there's much more content out there on Room Now. Thank you.